plenary is wrapping up. As you see, one of the delegates from Mexico is still not here, but
She's on the way.
she's on her way. But we want to make sure that we do the best with these 45 minutes that we have. So first, thank you everybody for being here. Just to mention that there is interpretation into Portuguese, English, Portuguese em vou falar em português, para os que falam por brasileiro aqui, se vocês colocarem o foninho, tem interpretação inglês, português, inglês.
It's okay.
And thank you for IPEN for making sure that this is also provided as a way of including more Indigenous people's participation into this meeting. This lab is co-organized with IPEN, with our dear Yu Jung, sitting here right in the middle. We are going to hear more from her and many other voices. So without further ado, I just wanted to make sure that this meeting remains focused on how we are implementing Article 60. We are not here discussing if mercury is a health hazard. We know that. Here we are trying to really focus on sustainable health care services for prevention, treatment and care of exposed population, strengthening capacity for diagnosing and treating mercury exposure. This is what this meeting is about. And we have a stellar panel, and we want to be all to be part of this conversation. So my first speaker, and I have the honor to introduce you to Dr. Marcos Orellana, the Special Rapporteur on Toxics and Human Rights. Marcos, and I forgot to mention everybody, you have 5 minutes, and I will try to be very strict to that to ensure everybody that we can have a mini discussion at least. So Marcos, the floor is yours. Thank you.
Thank you. Thank you very much, Ana Paula, and thanks to the organizers for their kind invitation for me to join you here tonight. In thinking about health, human rights, and mercury impacts of small-scale gold mining, and particularly the right to health, the first point that I wish to make is the connection between the right to health, the right to life, and the right to a clean, healthy, and sustainable environment. For a number of decades, there was a lot of effort by a number of people in trying to get global recognition of this right, the right to a healthy environment. This right had been recognized in a number of national constitutions at the regional level, and there, as I said, decades of efforts. In 2022, the UN General Assembly passed a resolution so recognizing this right. Now, that was the start of a debate which had some member states arguing that, well, General Assembly resolutions are political declarations, they're statements, they don't establish international law. Now, those arguments, I will say, were put to rest by the International Court of Justice, the principal judicial organ of the United Nations, in its advisory opinion on climate change obligations, as it reasoned that the right to a healthy environment is essential, inherent, indispensable for the realization of the right to life and the right to health. And so for a member state, a country that is a party to an international human rights treaty that protects the right to health, for example, that means that by implication, that party is also obliged to respect and protect the right to a healthy environment. That is a first point that I wish to make. A second point, and following from that, is, well, how clean is clean and how healthy is healthy? And that is where the debate comes in with standards. As environmental law has unfolded, at least since 1972, the UN Stockholm Conference on the Human Environment, sovereign states determine binding standards within their territory as pertaining to environment. Now, the interface with health brings in the role of the World Health Organization and other international organizations, providing guidance and standards as well. So this relation between international standards and national level standards is an issue that opens up a number of points for debate and discussion that I won't get into today. The point I wish to highlight today is that given the advances in science and given the advances in technology and the ability to detect the presence of mercury, the current standards that exist in countries around the world, and arguably the current standards that the World Health Organization has, may be inadequate to provide protection to the population and thus need to be revised. They need to be re-examined. And that opens up a whole question of process on how to do that. Uh, Time is going fast, and so that's a second point. Third and last in the 5 minutes that I have is to talk about access to justice and effective remedies. This is the topic that I address in the last thematic report, which I presented to the Human Rights Council in September in the context of toxics. There is an element of access to information. When it comes to people exposed to mercury, say because of fish consumption, and they're given test results, this is the concentration of mercury in your blood or in your hair. And people says, well, what do I do with this? What can I possibly do with this number? And so access to information is not just the results of medical monitoring. It's also guidance on what to do about the problem. So that's one element. Another is on the health dimensions. So medical monitoring is not a one-off. There have been cases, and I recently sent a letter, for example, to Colombia because of insufficient implementation of a constitutional court decision on the river Atrato. This was a landmark decision because it recognized rights to a river, but it's much broader than that, where the Constitutional Court ordered a number of measures for the protection of the population, including for health, including medical monitoring. But it's not a one-off matter. It's a matter of due diligence. It's a continuous process. And it must be associated, as the court reasoned in that decision, with adequate healthcare, with specialists and specialized healthcare for people that may exhibit symptoms and clinical manifestation of mercury poisoning. I am already out of time, so I want to again thank the organizers for the invitation and for your attention. Thank you.
Thank you so much, Special Rapporteur. Thank you for highlighting the international standards. That's a matter of legal obligation, but also that difficulties in translating to national context, into laws, policies, and so on. That's why I'm now turning to Miriam Gabriela Medel Garcia, who is the head of the Environment and Global Health team of the Permanent Mission of Mexico here in Geneva. Miriam, maybe it would be interesting to hear from you exactly about that, like lessons learned on the implementation of Article 16 in Mexico. Over to you.
Thank you very much. It makes me nervous when I see somebody with their clock. I'm going to try to be brief. Thank you. No, well, first of all, thank you for initiating this dialogue. I think it's very important that we stop considering these conventions in a siloed way, which we have been doing. In many ways, as a result of the sectoral nature of development over the past century, we are at a different stage now. And then from Mexico perspective, this convention and all conventions, all MEAs must be implemented as an integrated system. So what do I mean by that? It's of course easier said than done, but the belief and the aspiration is that we must articulate all the articles of the Minamata Convention: supply, trade, products, emissions, waste, contaminated sites, so that the health actions reinforce environmental and socioeconomic measures. We really believe that creating synergies across the convention pillars and with other conventions will ensure that mercury control translates into tangible health benefits. And we often talk, I mean, it's kind of almost like a buzzword in our job. Oh, let's do synergies, and there's always an agenda item and collaboration with other MEAs, etc. But I do believe that this collaboration and actually this synergistic work has to start on the ground at the implementation level in the countries because that's why we go and we subscribe to all these instruments. We believe, somebody mentioned earlier today, and I thought it was very interesting in the plenary, that we need to embed the work of the One Health approach into the Mercury Convention. And sometimes we just see it very differently. We think that we're going to apply One Health into health agenda items, but not on the other way around. So for us, we believe that we have to recognize that human, animal, and environmental health are interconnected. And mercury pollution is a very clear example that demonstrates the nexus. We have contamination of water and fish, which threaten the ecosystem, food security, and community well-being. I will not go into all the things, the amazing things that Mexico is doing. We have work on dental amalgams, on cosmetics. Actually, earlier today, I heard back from my health ministry that we are on board for the 2030 deadline for dental amalgam. So this is good news coming from Mexico. I would actually just refer very briefly to the challenge we face with production and with trade. So we, as you know, Mexico, Indonesia, and I heard China today in the plenary, are the only mercury producers in the world. So we have a very, very specific situation. It's not only the small scale ASMG, it's also the mercury mining that is affecting our populations. And then, as you also heard from the very eloquent statement from the University of Querétaro in the plenary, we have a problem with organized crime, which we need to sort out. Is not easy. It's quite just the contrary, but at least there is, I mean, I do want to say that there is an acknowledgement from the government about this. And there is also this awareness that the only way to solve it is through work that is collaborative across the different ministries, but also with other levels of government, subnational, even local, and then with legislators, with leaders of the communities, and with the indigenous peoples leadership. For us, the health pillar is the cornerstone for the effectiveness of the convention. And I hope that we will make some headway, both at this conference, but most importantly, back at home at the national level. Thank you very much.
Thank you so much, Miriam. I'm here, I'm told that this computer is streaming, so I must make sure that nothing happens to it. So, that's what I'm worried. Thank you so much for bringing this perspective that we actually, this siloed approach, it happens so much. Like states come here and just things like, oh, let's focus on Minamata, forgetting that there is a bunch of other obligations, including human rights obligations, that continue applying, and they are applying all together. Indigenous peoples are here. The UN Declaration on the Rights of Indigenous Peoples doesn't cease to implement, to be valid, because states are claiming that they are implementing Minamata and so on. So thank you for all this. But you mentioned production, trade, organized crime, and I think that gives like the perfect hook for our next speaker, Yuyung Ismawati, who is the co-chair of the International Pollutants Elimination Network. You have the floor.
Thank you, Anna, and thank you all the speakers for taking your time to attend this knowledge lab. Okay, I prefer to call it side event, but it's not side event. Anyway, so you can't. So I would like to introduce myself that IPEN is a global network of more than 700 NGOs in 131 countries. And we've been following this negotiation since the beginning, since 2008. And we are I think delegates can change, but we remain here. So, okay, so I would like to start by showing this gold rush map in 1800s. You can see it's only several spots there. But then now we have a modern gold rush, which is spread out in 77 countries. And as you can see that the oranges circle, there are the territories of indigenous peoples, and extractive frontiers in yellow, and then ASGM countries in brown. To zooming in one country, you can see these kind of hotspots of artisanal fossil gold mining, and this is my country. we found more than 180 hotspots in Indonesia that use mercury a lot. And you can see that from at the bottom left, miners admitted that they use mercury about 3,500 tons a year. So that's massive.
How much?
3,500 tons, yeah, a year.
Only?
And then if you look at the ground level, this is how it works. Children, mothers also stay in that processing areas, and fathers mixing mercury to make it more pure and better to be used. And then they process it and then produce amalgam and they burn it. So we know that the exposure pathways of mercury coming from food, coming from air and water. And I would like to highlight here that there are what they call it malakas of mercury poisoning. And there are different branches of potential diseases from mercury poisoning. The top one is mercury poisoning in general, and then in the middle, it's the infantile mercury poisoning branching out of different kind of diseases. And then the below chart is the fetal methylmercury syndrome. So it exists, this kind of map. If you're zooming in again at the ground level, where when gold was burned, the mercury vapor has been spread out like this. So the source is the center, and then it's getting far and further, reach out 5,000 meters from the source. And the WHO standard for this is less than 1,000 nanogram per cubic meter, considered as safe level, but it's not safe if you're inhaling mercury all day. But that's the only standard that we have at the moment. And the US Human Health Services have a more elaborate warning and standard about this. If the reading of mercury vapor in one area is between 1,000 to 10,000, people have to be warned and prepared to be evacuated. And then if it's more than 10,000, people have to be evacuated. And I will show you this kind of map. So we measured, this is zooming in one village. The green one, I don't know if you can see. Yeah, the green one is the safe level. And then the yellow one over here, there's a couple of yellow. And the reading is between 1,000 to 10,000. So if you see red dots are everywhere, how are you going to evacuate one village? And this is happening every day. Okay, so as a result, I've seen this kind of things on the ground. It's heartbreaking to see these children every day, and I get the message from the healthcare facilities and workers to inform me that, oh, there is another baby, born with this and that. And experts in 2016 calculated the economic losses from mercury pollution cost about 77.4 million if we use the 1 ppm reference standard. But if there is no standard, it will be more. And then, yeah, these kind of pictures we can find underground. And I also found some children like this also in other countries. Yeah, so a lot of this, I can say it. And my recommendations, IPEN recommendations for this is that we need to develop healthcare service for prevention, treatment, and care for mercury exposed population, especially in and around ASGM hotspots. Special attention should be given to remote, culturally appropriate healthcare delivery for Indigenous peoples populations. And then strengthened institutional and healthcare professional capacity to conduct early detection, diagnosis of mercury poisoning, and then treatment and monitoring of health risk related to mercury exposures. All parties should develop a program for healthcare professionals to integrate the early detection, diagnosis, and safe treatment for mercury intoxication, including training programs for midwives and primary healthcare workers. And then lastly, all parties should maintain biomonitoring data annually and establish a follow-up health measures to take care of children in special needs in ASGM hotspots. Thank you so much for your attention.
Thank you so much, Yu. Well, our next speaker is Dr. Rudiger Kresch, who is the Director of the Environment, Climate Change, and Migration of WHO. You've seen that WHO has been mentioned in several of the presentations so far, be reference to WHO guidelines or the One Health approach. So I think it would be interesting to hear from you, picking on the recommendations from IPEN on prevention, early detection, treatment, care of mercury-exposed populations. What from WHO, what has been the lessons learned? What are the recommendations that are coming from you there? Over to you.
Yeah, thank you very much, and a very good evening to all of you. I'm really impressed that at this late hour we have a packed room, and we have that because we're talking about a real big issue here. And we just heard what the health effects of mercury contamination is. Basically, of course, there's WHO guidance on it. There's norms and standards, and indeed, as Marco said, we're updating our guidance and the norms on a recurrent basis. So the last one we did was in late 2024, where we actually looked at the practical guidance on how to do exactly what you said, to early protect, to protect, to prevent, and early detect and care those mercury contaminations. Now, I think the biggest issue is, of course, that it shouldn't happen at all. So the things that you've just mentioned, they should not happen, because we do have alternatives to mercury in the gold production. So the first thing the first lesson to be shared is, of course, that there's a huge capacity development need for people to understand in how little contaminations we are seeing remaining health effects. And those health effects, of course, are irreversible neurological damage, kidney dysfunction, and developmental delays in children. You've just seen all the pictures, the photos there, and it's so heartbreaking to see so many children being victims of things that can so easily be prevented. So what we're doing in WHO is we look at the determinants of health. There's social determinants of health, where we see that people are more exposed who are poor, who have to work in those very bad working conditions like we've just seen. We're looking at commercial determinants of health, where obviously commercial interests drive production cycles that are health harming. And at the same time, we work with those stakeholders to actually go a different route, to actually change the way they do business and create well-being societies. So the village that we've just seen could definitely be changing the ways of production and having zero mercury in that production chain, right? So that, however, of course, necessitates that we all work together. It's not just WHO. We're looking at it from a health point of view. But then, of course, we need to work with UNEP, sitting here right next to me, and other main UN bodies and the civil society organizations and the academia to actually make a difference to ASGM, right? So you were asking about what do we do in terms of country support. We're piloting the chemical, the biological, the biomechanical and psychological hazards of ASGM. We've been doing this in Ghana, in Nigeria, in Mozambique, and other countries. Now, for instance, by training health workers, we can, by training health workers, by raising awareness in the health sector itself, I think we can do a lot of a lot of good, because very often, again, our health workers do not detect the early signs of mercury poisoning. And that indeed is a thing that the health sector, so ourselves, we can take up. Of course, then we also need to do with countries a bit much more on chemical surveillance and health system coordination, as you have said before. I'm really sorry that we just have a couple of minutes for this, because it would be worth going much more into detail what we can do on the ground together, because as we see, this is a daily thing that is happening that should not be the case. So I think you're coming together at this COP to really discuss this issue is so important to really make a difference in the world. Thank you so much.
Thank you. Thank you. So we tried to get this room for longer, and we've turned it, if you don't leave by 6:45, we'll turn into pumpkin. And just acknowledge that there are 2 indigenous peoples from Brazil. They arrived and they need interpretation. So if there are someone that can give one of the seats that they are headphones. Sorry. So thank you. I wish we had more time, but your presentation is the perfect link to our next speaker, Lucas Infantosi Albertoni, who is a doctor and also from the Secretariat of Indigenous Health from the Ministry of Health of Brazil. Lucas, if you could tell us a little bit about Brazil's operational guidance for health professionals on the care of indigenous peoples exposed to mercury, that would be great. Thank you. And 5 minutes, please.
Thank you. It is an honor to represent the Ministry of Health of Brazil through the Indigenous Health Secretary, responsible for coordinating the national policy dedicated to indigenous health, and for managing a unique health subsystem that reaches almost 1 million square kilometers across the Amazon and other biomes. Today, there are 34 special indigenous health districts covering this vast area and more than 20,000 health professionals working in villages, along rivers, and across border regions, ensuring the right to health and some of the most remote territories on Earth. Mercury contamination in indigenous lands is one of the most serious expressions of environmental and public health crisis that affects the Amazon. The advance of illegal gold mining, the lack of control of mercury use, and the degradation of river basins have caused profound harm to both the health and the culture of indigenous people. Territories such as Yanomami, Munduruku, and Kayapó are among the most affected. Mercury recognizes no borders. It travels through rivers, through rain, and through the fish that sustain entire communities. The Minamata Convention is for us a symbol of hope. It demonstrates the ability of the international community to act collectively in the face of challenge that is at once environmental, sanitary, and human rights related. The Indigenous Health Secretary, or CESAI, has been expanding and strengthening its response to mercury exposure through integrated approach that combines primary healthcare with environmental surveillance. Among our most recent initiatives, we highlight first, the publication of the technical manual for the healthcare of indigenous people exposed to mercury in Brazil, developed jointly with the Oswaldo Cruz Foundation, Fiocruz, the Indigenous Ministry of Indigenous People, and several partner institutions. The manual helps health workers detect mercury exposure and connect patients to proper treatment, make Brazilians' health system stronger in regions facing environmental risk. Its launch marks a new phase in the state's response to the impact of illegal mining, an unprecedented effort to protect indigenous life. After its launch, In May 2025, implementation began in the most affected territories, with printed and digital distribution and training courses led by experts across multiple disciplines. CESAI also supports scientific research, such as the longitudinal studies with indigenous pregnant human and newborns exposed to mercury in the Amazon, conducted in partnership with Fiocruz. The study follows 177 pregnant women and 121 newborns in the Tapajós Basin. Examine the long-term effects of mercury exposure on child neurodevelopment. We also support other academic research projects across several states like Pará, Amapá, Roraima, and Rondônia. But identifying case is not enough. We must also provide specialized clinical care to understand how mercury affects child development and to offer answers and comfort to affected families. In 2023 and 2024, more than 120 neuropediatric consultations were carried out with biological and genetic analysis, with partnership with Fiocruz, the University of São Paulo, and Boston College University. These actions combine science, care, and human connection, representing an unprecedented step forward in the follow-up of affected communities. In June 2025, CESAI created the Committee on Mercury, Pesticides, and Other Environmental Contaminants, bringing together all departments of the Secretariat and formalization a coordinated approach for prevention and surveillance across indigenous territories. CESAI has played an active role in a strategic plan for healthcare, surveillance, and promotion for population exposed to mercury, developed with other departments of Ministry of Health. This plan aims to strengthen sustainable funding, political coordination, and intersector cooperation to ensure the long-term implementation of national actions against mercury contamination. Also, CESAI is advancing the formulation of a proposal for a national reference center for health and mercury exposure, a proposal to integrate specialized care, laboratory and epidemiological surveillance, research, and professional training. This center seeks to create a network of knowledge and care, unifying scientific evidence, territorial experience, and ethical commitment to the health of indigenous people. Mercury contamination is silent, yet its consequences are devastating and felt across generations. Brazil reaffirms its commitment to life, to environment, justice, and to rights of indigenous and traditional people. We will continue to collaborate with the international community, guided by science, solidarity, and respect for the ancestral knowledge that keeps the forest standing. Thank you very much.
Thank you so much, Lucas. And also acknowledging that some of the people that you have mentioned,
Yes.
Munduraku, Kayapo, Yanomami, they are present here
Yes.
in the room. And hopefully we'll have time to also hear from them. Our last speaker is Morningstar Gali from the International Indian Treaty Council. I wish you were sitting here with us, but apologies for we're stuck with this format and chairs that don't move. Please, over to you.
Jimmy Sunway, Morningstar Gali, Ilik Atike, Chi'i, Ma'achimoy is Chi'i. My name is Morningstar Gali. I serve as the California Tribal and Community Liaison for the International Indian Treaty Council. I have worked for IITC for the past 17 years now. And in that role, part of the work that we do is addressing the toxic legacy of gold mining for California tribes. And my tribe is Ajimoy Band of Pitt River. I want to start by sharing that combating mercury contamination is a significant challenge for California's indigenous communities. particularly affecting our sacred lands, waters, and traditional food sources that are affected by industrial pollution, mining, and other activities. Solutions for this should be culturally relevant, grounded in Indigenous knowledge systems, and supported by scientific and policy-based approaches. And so in unearthing the hidden histories of exploitation and environmental harms, one of the sites that has been most affected is that of Clear Lake, California, for the Elam Pomo, the Elam Modan people. And this is the family, direct, immediate family of my children who have direct health impacts. Next slide, please. Between 1848 to 1855 was California's gold rush, where the quote unquote discovery of gold took place at Sutter's Mill, just about an hour north of Sacramento, which is the state capital in California, created the establishment of mining towns and infrastructure. I should add that these mining towns are now back in operation and development with plans to mine gold again within Nevada City and the county regions. The impact on Indigenous communities includes displacement and destruction of our ancestral lands and violent suppression and the ongoing genocide of our California Indian populations. Next slide. There we go.
You did.
Thank you. As I mentioned, the area of Clear Lake, California has been dated back of archaeological evidence of over 14,000 years. It's one of the oldest freshwater lakes within North America and has been severely impacted by mining activities, including the sulfur vein Mercury mine. This is a Superfund site that is right next to the Elam Indian colony. And so for my children's relatives, they are living directly next door to a Superfund site, and the healthcare services such as Indian Health Services that serves the local tribes does not know or understand what it means to live next to a Superfund site and does not have an understanding of the ongoing health impacts. I'll share that out of 10 elders over the past 12 years, there's only one surviving elder, which is my children's grandfather, and all of his siblings have passed on from various forms of cancer. Next slide, please. This is mercury contamination from mining operations in the late 19th and early 20th centuries. And this is what the lake now looks like in terms of the cyanobacteria, elevated levels of cyanotoxin that have been found. This is Big Valley Pomo, who have been really active in testing the water for the tribal communities. The water, even at this moment, is 100 times the levels of what is understood to be safely consumed. And so when I send my children there, even though they don't drink the water, they're washing their face, they are brushing their teeth with this highly contaminated waters. This is my daughter. Her name is Ha'ali Elderberry Autumn Moon. She was born under the lunar moon. And so this is her in her traditional dance regalia. And, you know, this talks about, you know, when you have fished in, you know, for subsistence fished for generations, for 14,000 years, you tell the community to stop eating the fish because it's poisoning you, to stop going to the water and practicing your cultural practices and ceremonies. You know, these are violations of the UN Declaration on the Rights of Indigenous Peoples due to the destruction of the culturally significant ecosystem. I will also share that this was the Bureau of Indian Affairs and Environmental Protection Agency that both were responsible for the contamination of the area. Apologies, I'm going. This also brought sexual violence and exploitation in terms of mining town realities. These were predominantly male populations. There was a lack of law enforcement, a lack of any sort of justice for California Indigenous tribes, trafficking that continues today in terms of the impact on Indigenous women of the cultural and family structural displacement. And then in terms of the contemporary parallels of environmental racism and ongoing violence against Indigenous women, there is a continued connection to extractive industries and man camps, and a lack of access to clean water and natural resources, with the mercury continuing to contaminate food supplies, fishing, and food sovereignty. This is part of our advocacy that we do in terms of connecting the movement of missing and murdered Indigenous women to cleaning up the toxic mining sites, and a demand for accountability in terms of those violations of environmental harms. Some of our call to actions that we are participating and helping to lead in terms of addressing those accountability for corporations tied to extractive industries. And for conclusion, the legacy of gold mining is one of exploitation, but very much one of resilience, that we are continuing to practice our culture and continuing to amplify Indigenous voices and advocacy. So, Sulai, thank you.
Thank you so much. We are getting well over time, but I will take a leap of faith and go another 5 to 10 minutes, hoping that this is going to define, because I think it would be interesting to hear from you. I'll propose that the benefit of time, we only take from the floor questions or explaining like any best practices or some lessons learned from implementing health and Mercury. So I see 2 hands, and please, everybody has to be very short because we have a commitment to leave this room now. Please introduce yourself.
Thank you very much, Chair. Good evening, ladies and gentlemen. Stephen Kwiringira is my name, from the part of Africa, Uganda. Ladies and gentlemen, thank you very much for giving us this opportunity to link up the Minamata Convention, the Mercury, with the human rights. Ladies and gentlemen, you may all be aware that in 2022, the National Labour Organization designated occupational safety and health as a fundamental human right. And from all the talk, I have a feeling that there's something where we have not talked about so much. The occupational safety and health in regard to Mercury. In OSH, we talk a lot about hazards and controls. And it so happens that we are talking about one of the controls, the elimination. Whereas the elimination, we know that it is a most efficient way of controlling these hazards. But we are talking about now in a phased manner. So as we phase off, what are we doing in the present to ensure that our people are not exposed to mercury, or the effects are not being worsened by the
Thank you.
actions?
Thank you very much for bringing this perspective of OSH here. The gentleman next to you.
Thank you.
I will give to Dee.
Luis Fernandez, Wake Forest University in Cincia in Peru. A question for a colleague from World Health Organization. What's being done to harmonize methylmercury biomarkers across countries? The case that I want to just point out, Peru still does not recognize hair as the biomarker for assessing methylmercury contamination populations, and they still use urine. So how do we get this protocol across the board and countries to be able to do comparisons over time and over space?
Thank you very much. Lee?
Yes, I just wanted to raise the issue. Can you hear me? Yeah. I just wanted to raise the issue also of ASGM and contaminated sites, and the fact that even if we were to eliminate the use of mercury in ASGM tomorrow, that we've effectively created thousands of contaminated sites around the world that will have ongoing implications for human health for decades, if not hundreds of years to come, because of the enormous expense of cleaning them up and the health impacts on the food chain, and then the exposure that that presents to Indigenous and other sensitive populations as well. And so I think it's important for people to understand that every tonne of mercury that goes into ASGM production creates hundreds of years of legacy and costs for national governments, as well as human health exposures along the way. And in that, you have to do some sort of analysis of whether it's really worth extracting that gold, and whether the short-term benefits, if you like, to the market are in any way comparable to the long-term harm to human health and the cost to the nations that host ASGM.
Thank you so much. Any more hands? Okay, Ty. And that I think will be the last intervention from the floor, and then I will give it back to you.
Yes, many times we have these sessions and we speak about the harms, and obviously we understand that, but what can we bring back to the community as far as ways to handle it, or whether tests, or for example, with the dental amalgam? There's a lot of people in the island that have the mercury fillings. And I've also read that it's very dangerous because of the fumes to remove those. What words of hope can we give to people that have been affected by this contamination?
I'm now going to go I will start from my extreme and 1 minute each. I think you managed to get the questions. There are questions on occupational safety and health, on harmonized biomarkers, ASGM, contaminated sites, and what words can we bring back to communities, what words of hope. And if we can start this way, 1 minute, and then I think we will be excused.
Very good. And first of all, I'm really happy that the colleague mentioned OSH, that we look at occupational health and safety. To your question, whether or not WHO recognizes hair as a biomarker, yes, we do. Our recommendations include scalp hair among biological markers, and also, of course, together with cord blood and urine. So it's a whole mix of methodologies. But I have my colleague here with me, who is much more the expert. There's Richard, and there's more. So perhaps you can add 20 seconds on this, please.
Thank you. Yes, WHO recognizes this is an issue that we encourage people to do biomonitoring, but people don't necessarily have the values to interpret those results. And we are starting a process to try and publish harmonized WHO reference values to help with that interpretation. But the formal process will take a while, so it will take at least 12 months, if not longer, to try and publish good reference values which people can use just for that interpretation. Thank you.
Lucas? Pode falar
em português. Vou aproveitar que existe uma tradução e vou falar em português. Através do manual de atendimento aos indígenas expostos ao mercúrio, a orientação que a gente tem seguido, infelizmente, gostaríamos de ter melhores notícias, mas o que temos seguido por enquanto são orientações, né, comunicação de risco, para que se evite o consumo de certos pescados, principalmente os pescados que são piscívoros, né, que comem outros peixes. E prezar, né, principalmente pelo consumo de pescados que comem somente vegetais, né, diminuindo as concentrações e a biomagnificação. A gente espera que com isso a gente tenha uma redução do impacto, né, mas o impacto que já foi feito, principalmente o impacto neurológico no neurodesenvolvimento de crianças, ele é irreversível. E o que a gente tem proposto ao governo é que se dê pelo menos todo o processo de reabilitação a essas crianças para que tenham possibilidade de viver de acordo com seus direitos adquiridos.
Obrigada. Do you?
Yes, thank you so much for coming today. This is a very important discussion, and I'm sorry that we have only 45 minutes. But I hope that in the next COP, we will see more Minister of Health coming. I think it should be mandated for delegates to come to Minamata Convention with Minister of Health as one of their delegate members. The second, I hope that next year during the World Health Assembly, WHO can elevate this issue, because it was discussed back in 2017, 2022, okay. 2023, yeah,
exactly.
yeah. But I don't see any Ministry of Health initiatives in stronger addressing this issue of mercury poisoning, especially. And lastly, on the occupational health, I've seen a lot of different kind of diseases, including one of it that addressed by minors is about their infertility. So that's also another issue that very little attention. So many of the birth defects in ASGM sites, they blame the women for bringing children with birth defects, but actually maybe the sperm also got defect, but there is no information about it. So I hope there will be more research on this and more donors supporting the real issues of mercury, not only promoting gold without mercury. Thank you.
Marcos.
Thank you, Ana. Thank you, Ana Paula, and thank you for the questions. So a message of hope. Well, it's easy to become despondent given that we come here to the Conference of the Parties and the evidence is mounting on the dramatic impacts that year by year we see gathering. And the response that we see from governments is to propose tweaks on the margins of with resolutions that are largely cosmetic. And sure, there are advances and it's important. Consultations are important and refining the instruments is important, but more implementation or a focus on implementation of an instrument that has a design flaw will not solve this problem. And so we're left with the hope that if when looking at other instruments that have gone through a similar inertia for many years, say the Basel Convention on Hazardous Waste movements suffered from paralysis. And then that paralysis was unlocked. And then there was a lot of movement with the entry into force of the Basel Ban Amendment, among others. So what we can expect, we should demand our proposals for the 7th session for amendments to close the gaps and shortcomings of this instrument, to shake things up, and so that prevention is the real guide. Thank you.
Thank you, Marcos. Miriam?
Thank you. Thank you very much. And also thanks for all the reflections and the questions afterward. I think to me, okay, I will actually switch a Thai's question and I will direct it to me. What gives me hope? I mean, yes, we have the progress here is extremely incremental and we may not have enough time, and it's not acceptable that things that happen now are still happening when there are the means and when there are alternatives. However, I would say what gives me hope is that we're here. People seem to be at least positive. There is awareness from the parties that this needs to stop, that this issue has to have its place in the universe of, and in the very, very saturated universe of all issues that are discussed in a United Nations setting. So to me, that is actually hopeful. Yes, we have to hold each other accountable. And then when we go back home, and specifically when you go back home, because I am a delegate from a country, but when you go back home, I think that accountability has to come from our elected leaders and from governments. And I think I always like to tell civil society, please engage early. Engage the next, November 8th, start engaging with your government, with your legislators, with everyone that you can that will listen to this. Because why? Because when we get here, I already have instructions. And it's sometimes very, very difficult for me to move or to change. So that would be my message to all of you regarding this. And I thank you for making this possible, this dialogue possible.
Thank you.
And just before you go, I'm sorry, we have final words. I think it's timely that I'm not closing this event. I'm giving the floor to Jairo Munduruku, who comes from one of the communities most impacted by mercury contamination. Jairo, rapidinho, por favor. And after
Morning
that,
Star.
refreshments offered by IPAN are waiting for everybody outside.
And Morning Star.
Oh, Morning Star. You want to also?
Boa tarde a todos.
Okay, Joe first, and then
Jairo.
Brevemente, né? A questão do mercúrio é muito séria em nossos territórios. Não só com a população munduruku, mas sim na Amazônia inteira. Para tentar reverter a situação do mercúrio contaminando as pessoas, é necessário que adote uma tomada de imediato a suspensão de uso de mercúrio no garimpo. Então, já desde a década de 50, está avançando, pois o mercúrio está trazendo uma doença silenciosa que não é vista na sociedade brasileira e muito menos países internacionais não vê a situação do nosso povo que está doente, contaminado por mercúrio. Se por estar contaminado, quantas e quantas toneladas de mercúrio já foram lançados no solo para tentar pegar o minério que é prejudicial não só ao meio ambiente, mas sim também à nossa cadeia alimentar. Nossos peixes contaminados, o nosso rio poluídos, e nós não temos outra alternativa. Só temos o peixe, é a nossa tradição. Então, é sério, a vida nossa está em risco. Estão trazendo uma morte silenciosa sem que a sociedade saiba. É sério o mercúrio. Então, as mulheres que estão grávidas com as crianças, elas já nascem com problemas neurológicos. Então, nós estamos aqui na Convenção Minamata para dizer à sociedade que fornecem mercúrio, com o propósito de dizer que para pegar o minério, ouro, mas na verdade ela é jogada e despejada no solo e contamina o meio ambiente e as pessoas. Quero deixar aqui essa mensagem para todos, para que as pessoas realmente se conscientizem, que possam pensar de imediato a paralisação do comércio desse metal que é venenoso. Ela mata silenciosamente. Ela não tem reversão, não tem cura. Então, eu quero deixar essa mensagem para todos nós. Não só para o mundo, mas para a nossa sociedade.
Obrigado.
Muito obrigado.
Obrigado, Jairo. So I lied to you when I say that he was closing the morning. And I promise that after that, there is nothing between you and the refreshments outside. You, please close the meeting.
I'll be quick.
right one. No, that's the right.
Thank you to Ty Pelly for her statements, and to all of my colleagues at International Indian Treaty Council for their dedication to addressing these violations of our Indigenous rights. What I didn't share earlier is that what redress is there when there's misconceptions about our tribes in California, that we have sanitation, that we have clean drinking water, and that's very much not the case. What redress is there when our roads and our housing foundation was lined with mining tailings, with mine tailings. There is no redress when an entire tribal community has now had exposure that is being passed on through decades. What I didn't share was that my youngest daughter is legally blind and legally deaf, wears glasses and hearing aids from a very, very young age. And all of her cousins do not necessarily have, the access to specialty doctors that she has. And so this is affecting our future generations. And so that is my message to you, to please pay attention, because this is very much a reality for our tribal communities. Thank you.
Thank you. Thank you. With this, we declare the meeting, the knowledge lab, the non-side event of COP6 closed. Lucas asked me to just invite you all to the presenting the manual that he introduced here tomorrow at a knowledge lab, I imagine,
Yes,
at 6 p.m.
6 p.m. and
Which room?
Next week.
Next room.
Thank you all, and let's continue this conversation outside of this room.
Thank you, Anna. Thank you, everyone.
Sorry about
It's okay. It's okay. We need to talk. We have some better.